come up with a spiffy title, Health Transformation All Aboard for a Long Journey. It's probably not going to be selected to be the title of a movie or anything like that, but it's probably not a bad title for us. I think, I was surprised at how many people I knew here, and I know all of you find this topic to be very important, whether you're in the public or private sector. And it's a very interesting topic right now with all the change going on. And I think we're very early on to a journey that the country and the state of Florida will take over the next probably decade or so. I'm going to go through this in three chapters. First, I'm going to spend a little bit of time on a market overview and a case for change. I don't think it'll be anything new for you, but it's a good starting point to provide that 30,000 or 50,000 foot level for the rest of the summit. Then I'm going to talk a little bit about what we see as industry transformation, literally in every part of the industry, whether it's the health care delivery industry or the health insurance industry, certainly the government and employers. And then I'm going to finish up in the last chapter with a little bit about what my company, GuideWell, is doing as we become part of the solution and as we transition from an insurance company to a health solutions enterprise. I'm going to talk generally about how I see things in the market, and it may sound a little negative at times for an optimist, and I don't mean to throw stones, and certainly we see that we're part of the problem as well in the insurance industry and have to be part of the solution. So, huge industry, lots of major traditional and new stakeholders, and I can't believe it, but I think I found something that every stakeholder agrees to. And that's that the system is broken and needs to be changed. So from an employer standpoint, business leadership, in the United States healthcare system, the dynamics of supply and demand and the foundational ingredient of performance transparency are weak. From the president, if all we're doing is adding more people to a broken system, then costs will continue to skyrocket. And from a physician, as a physician, I know that physicians focus first and foremost on providing the best patient care we can within the confines of a broken healthcare system. And this is an industry that's approaching $3 trillion. So that's a pretty amazing. So I think everybody agrees that what we've got right now is not sustainable, has to be changed, has to be improved. It's a question of how and when. I'm going to go through the next few pages and give you some facts and figures and so forth quickly to back this up. But before I do that, in many ways, the system we have in our country and in our state is the greatest in the world. It's the envy of the world. It's unbelievable what our hospitals can do, our physicians, the diagnostics we have, the pharmaceuticals that we have. It's really amazing how healthcare in this country can affect lives. But as a system, I think everybody agrees the costs are too high, way too high. The value for the investment we make, too low. And the financial incentives all over the place are misaligned, if they're there at all. And healthcare delivery and financing systems are often complicated, fragmented, and inefficient. You can read a lot of studies out there that say as much as 30 to 40% of all health care delivered in our country is unnecessary or redundant. So think of the waste that's in the system. So let's start with a quick look at the United States healthcare system, and I know you know this. The United States, by far, the most expensive country in the nation, whether it's a percentage of the GDP or on a cost per capita basis. And even though medical trend has slowed recently, it's still 3 times overall CPI. I think at this pace I read that by 2050, healthcare will be almost half of the entire economy. I guess from a mathematical standpoint, if it's possible, at some point it'd be 100% of the economy. Now what value do we get for our trillions of dollars? Low value. So on this chart here, red means bad. Overall ranking for the United States amongst the 34 nations participating in the Organization for Economic Cooperation is 34th, last. last in overall rank of these developed countries. Now, when you look at other indicators like quality of care and access, kind of middle of the pack. So as a country, we are not getting the value for our dollars. Now, I know there's a lot of employers in here. So if you take a look at the same issue from an employer's standpoint or an employee's standpoint, this is over decades. Look at how the rate of premium increases outpaces inflation and outpaces workers' earnings. While this cost increase is going on, look at the deductibles. These are for workers who work primarily for small employers. Going up, up, up. Now, one good thing about this is it starts to introduce consumerism into healthcare, which I'll talk about quite a bit. So premiums up, deductibles up. And then these are how many workers are covered by their employer. Again, primarily small businesses, on the decline. In fact, in Florida, if you were to compare it to other areas of the country, say the Northeast, the percentage of workers covered by their employer is much lower. Let's drop down to Florida. You know, we have a great state in a lot of ways in healthcare. Over 200 great hospitals, 50,000 physicians, over 5,000 great retail pharmacy locations that are evolving their businesses rapidly. The new retail or convenient care centers growing rapidly, and we have a strong public health system with over almost 400 federally qualified health clinics, 74 health departments, and almost 200 free medical clinics. I've been involved with the medical clinic in Clay County over near Jacksonville for years, and they provide services to the uninsured who are not eligible for government programs. And it wasn't a surprise to us that 2 years into federal health care reform, it's had literally no impact on their patient base. The need is just as great now as it always has been. So how about value for Florida? Generally middle of the pack. Overall rank, and there's lots of different studies here, but they're about the same. Florida's somewhere around 30th in value in the country for our investment. And you can see here through the various categories, generally in the middle of the pack. If you go a little lower, red here means below average in the country. The rate of uninsured in Florida, health spending, diabetes, mental health, and heart disease. All indicators that our system is not performing as well as we would like it to and below average in the country. Shifting gears for a minute to the health insurance marketplace. This is our view at Florida Blue on how we see the market evolving. Pretty confident, directionally correct. What this shows is that the consumer segments, Medicare, Medicaid, and individual under 65, all of which are heavily government-sponsored programs, are growing now and expected to grow rapidly over the next 5 years. If you look at the top there, the uninsured, it's declining from 3.7 million to 2.9 million at a time when the state's overall population is expected to grow. But that's still 3 million people without insurance. And then if you look at the bottom, that's the employer market, by far the largest and remains the largest, although it's projected to shrink in size over the next 5 years. You know, one of the things you hear about is there competition for health insurers. Well, in Florida there is. This is the number of carriers participating in the Medicare Advantage market and the new exchange market in the Miami, Orlando, Tampa, and Jacksonville markets. So you see lots of competition there. All the nationals see Florida as a primary market. They make heavy investments in products, services, and programs here. You see companies who have always participated in Medicaid moving up into the commercial markets for the first time. You see hospital systems beginning to enter into the insurance market for the first time. And Florida has a very strong, one of the strongest Blue Cross Blue Shield plans in the country. So that's, I guess, the good news, lots of competition. But take a look at the map of the United States here. So the colors represent how much have insurance premiums gone up in the new health exchange program from the Affordable Care Act. Red means more than 10%. So you see there, Florida, average premium increases year over year, early on in the program, over 10%. Green is good, yellow is middle of the pack. So we continue to have rising costs in Florida, despite everything that everybody's doing. So I know you're going to hear more about these kinds of stats and so forth later on, so I just wanted to give you a quick overview of what I think is a fair representation in general of the State of the Union, so to speak, in healthcare in the United States and in Florida. So let me switch gears now to Chapter 2. Like all big problems, big complex problems, there's lots of drivers of them. This is not an exhaustive list, but let me talk about a few of these briefly. First, the lack of consumerism. And I'm going to tell a couple little stories there. So suffice it to say for now, generally speaking, there has not been consumerism in healthcare. Provider fee-for-service payments. This is how healthcare providers have been paid by the federal government, the state government, all the payers for decades. Started, I think, with the Medicare program way back. So providers are paid for every procedure, every test that they do. So the economic incentives and the resulting business models are all centered around a fee-for-service payment program. This is one of the biggest changes that's underway in the country and in Florida in terms of reform. Unhealthy lifestyles, a lot easier to take a pill than it is to get up, eat well, and run around the block. Medical malpractice, high premiums, drives defensive medicine. An aging population. I think about 10,000 Americans are turning 65 every day. Medical technology. It's amazing the advancements in technology and in pharmaceuticals. Subsidized generally by the U.S. and much lower cost everywhere else in the world. Unfortunately, as miraculous as the results, again, at the system level, so far medical technology has generally increased costs. And there's many more causes. I'm sure you're familiar with these and have some of your own. So let's talk for a minute about what are the traditional, I'll call these the traditional major stakeholders doing: the government, employers, providers, health insurance carriers, and consumers. These are the major traditional ones, and I'll talk a little bit later about some of the new ones. But the federal government, with the Affordable Care Act rolling out, a very rough start, as you know, but it's doing one thing that it intended to do, and it is increasing access to care through insurance around the country. There are some provisions in the legislation that are designed to improve quality and drive to value, but that's harder and slower. The state government, transitioning its Medicaid program from a traditional fee-for-service program to a managed care program delivered by the private industry. Employers under the gun doing all kinds of things, experimenting with defined contributions, private exchange where they make a fixed payment and give choice to their employees and support in making a good choice. Worksite wellness for health and well-being and productivity of their employees. Healthcare providers. I'm sure, I know there's several of you in here are very busy running your day-to-day operations, but also looking forward to how you can change your business model and move from fee-for-service to value. Some of you are entering the insurance market. Some of you are looking at consolidation and integration. Insurance companies. We're entering new markets. Some of us are getting into the direct delivery of care. We're investing heavily in analytics and programs to support our members. And then consumers. Boy, talk about somebody getting dragged along into change probably didn't really know they needed or wanted, but consumers are now more and more selecting their own health insurance plan for the first time and paying for more of their health care. So the consumer is actually kind of at the middle of this. So I've been working on consumerism in retail and healthcare at Florida Blue for many years now, and there's two little stories I told way back then and throughout the years to groups. And this is a couple here you can see shopping for a TV. So if you're in front of a group like this and you say, How many of you have bought a TV in the last 3 years? You know, you can see the room perk up. And you say, well, what did you know about TVs? And people, I knew this, I knew that. What was your shopping experience? It was great. I went on the internet, I went to Best Buy. I knew all kinds of stuff about my options, quality, cost, and everything else with my TV. And it was actually fun. Okay? How many of you have shopped for health care or know somebody who received health care services in the last few years? Hands go up. What was that experience like? What did you know about your choices, your options? How much things cost, different sites of service, the quality? Just about nothing. And then you ask, okay, what's more important to you? Your TV or your health care? Most of the guys said the TV. Most of the women said health care. And I can see that debate. And I also told this one about the fee-for-service system. Imagine you go to a grocery store, you're pushing your cart through the aisle, and the clerks that work for the store are putting items in your cart for you. And you're just walking along and your cart's filling up. And you say, well, what are you doing? They say, well, we're not absolutely sure you need this, but you might. And I can't tell you how much it costs. But what I'll do is I'll send a bill to an intermediary, they'll process it, they'll send you a confusing EOB or something like that and tell you how much you owe. Quite a bit different than shopping for a TV or groceries than shopping for health care for consumers. And we've been conditioned this way. This is the way we all grew up. Think about it. You were on your mom's policy, you went to college, you were on the school plan, you got your first job, you were in an HMO. I don't know how many of you can remember when primary copay was $3. I think it was $5 on a basic plan to go to a specialist. Prescription drugs were about free. So that's how we grew up. How many of you are now in a higher deductible plan? Okay, some. If you're not, you're getting to be in the sweet spot of the minority, because most people are moving towards high deductible plans. It's going to change things for all of us. So I talked a little bit about what some of the traditional stakeholders are doing. Boy, I'll tell you, all of the retailers and technology companies that are in adjacent spaces are moving more and more into the healthcare space. It is too big of a market and has too many opportunities, given all the problems, for these companies to ignore in their growth strategies. Walmart intends to be the country's largest primary care provider. And they have a relentless pursuit of low cost. If you look at Google or Microsoft, look at all the things they're doing. The Walgreens, the CVS's. Everybody is transforming their business and moving further and further into the healthcare space. And I can't overstate what the small startup world's like. Literally hundreds, if not thousands, of startup companies here in our country and all over the world who are innovating in healthcare, particularly digital. It's one of the highest areas where private equity money is going right now. And so they're coming without the burden of being a legacy company. This is one little example here. This is Google's medical emergency response drone. So what this does, if you're in a natural disaster area or a hard-to-get area, a rural area, mountains, they can fly in medical supplies, diagnostic equipment, and the like. So this is just one example. If you look at this slide here, we work with a company called HealthBox. It finds small, early-stage startups and helps accelerate their growth. We've partnered with them for the last 2 years, and again this year. We started here in Orlando, went to Tampa and Miami. And they find small companies, and we invest in them, we mentor them, we hook them up with other industry players and try to help them innovate. That helps us at Florida Blue build our culture of innovation and make sure we're on the cutting edge, so to speak. There's a company called eTech, just to give you an example. that embeds a chip in a pill capsule. You take it, and it can detect whether you're taking your medication and give reports back to your provider because of the issues with adherence to prescription drugs. All kinds of remote tools. I think what they call the quantified self, where you can wear a band or have something in your house or something in your car that can monitor your biometrics, provide analytics back to you real time, send it to your physician or family member. All kinds of stuff going on there, all kinds of money. Very exciting time, and I know Renee Finley's on the next panel on telehealth, and she's in the middle of a lot of this. Okay, let me wrap up, and we will have some time for questions if you have them, by the way. Let me talk a little bit about my company and what we're trying to do to be part of the solution as we transition to a health solutions enterprise. So GuideWell is probably what you always thought of years ago, Blue Cross and Blue Shield of Florida. If you've watched our rebranding, you might think of us now as Florida Blue. But GuideWell is our new mutual holding company. We designed this to make sure we had the flexibility to diversify into a health solutions company. We have 4 major areas of focus. First, of course, our health insurance business, Florida Blue, Florida Healthcare Plan, which is a staff model HMO in the Daytona area that fully integrates the financing and delivery of care. We have one in Tallahassee called Capital Health Plan. We have a company you may not have heard of, Diversified Service Options. This processes claims and serves providers in the traditional Medicare program. About 1/3 of all Medicare beneficiaries across the country are serviced by DSO. They pay about $100 billion in claims a year and service over 40,000 providers. So it's a very, very big operation. GuideWell Connect, which I'll talk about in a little bit more, is our new consumer marketing sales and engagement company, and GuideWell Health, our company that owns healthcare provider assets. The purpose of this enterprise is really all aimed at helping to transform the Florida Blue business and lower costs and improved value. So in particular, GuideWell Connect and GuideWell Health are really there to support Florida Blue in its transformation. Okay, if you talk about a minute about our mission, vision, and values for GuideWell, the same as they were for Florida Blue. Help people and communities achieve better health is our mission. A leading innovator enabling healthy communities is our vision. And I'll talk about that in a second. I want to pick out 2 values here that you may not think of for an insurance company. The first is imagination. We really need to have a culture of innovation, and so that's very important to us, and we're building business processes and training programs and being involved in with smart, innovative companies. And courage. And I know a lot of you are in well-established, leading legacy companies in your sectors. It's hard to change when you're a leader. You know, I visited a company called Oscar in New York City a few weeks ago. They're probably one of the only new insurance companies, at least not coming from a hospital system in a while. And having worked in one a long time, I had to ask them, why do you want to get in the health insurance business? But they did. And their view is it can be reinvented. And they're doing a lot of things completely differently. And they have some advantages. They didn't have relationships with agents and brokers or hospitals, so they weren't tied down. They don't have big data. They don't have lots of IT systems. So it's harder to change sometimes than it is to start from new. But with courage and imagination, I think all of our companies, as big and successful as we are in the current business models, can make that transition. Now this is a picture of a bunch of us at a school in Tallahassee, and that's our Surgeon General there, John Armstrong. I think he's here tomorrow. So we partnered with Epcot and built a exhibit called Habit Heroes to teach kids and their families healthy habits from an early age. Eat right, get your exercise, hydrate, get your sleep. I added that one. And then we went from there and we developed a comic book with Marvel, teaching the same lessons. And I'll tell you, if you ever have an event, a community event, and you want to get kids and their family there, bring Iron Man along. He's he's quite the draw. But that's an example of what we do, and I know a lot of your companies do the same kinds of things, of getting into the community, advancing the mission. Because if you think about what I've been saying about how we've been conditioned, boy, if we can start early with the kids, early in physician training, early in nurse training, and retool it a little bit and aim it towards some of these new kinds of things, that could make a big difference. Maybe easier to teach than it is to change. Now, like you, we've been busy participating in employer-private exchanges, worksite wellness. We go on site to hundreds of employers and do health assessments and health coaching. You'd be surprised how often a worker gets a health system at work and goes directly to the hospital. There's people out there that are ticking time bombs and don't know it. Responding to federal health care reform, I won't get into how challenging that has been for us to respond to ACA. We're now participating in Florida's new Medicaid program with partners around the state. And then I'm going to talk about the last three a little bit more, expanding our health solutions, our diversification program, advancing consumerism, and innovating. Quick look at our insurance business. There's probably two takeaways from this page. First, look at all the consumer business. Under 65, over 500,000, including 300,000 in the new ACA program. Medicare and Medicaid, about 300,000 each. That's very large, one of the largest in the country. A lot of people buying, picking one at a time. The second takeaway is look at the employer business. Local, group, public, large, and national. By far our largest segment. So this consumerism in individual people in government markets gets a lot of play, but always remember the employer sector is by far the biggest, and we serve federal employees, state employees, lots of counties and school boards, and lots of opportunity there for change, lots of challenges. I remember a time, this is maybe 10 years ago, meeting with some of the public unions, and at the time the challenge was healthcare expense versus books and school buses. And retired teachers were actually coming back to work to drive buses to get the benefits because they're so expensive. Think about that. And at the time, we were starting to talk about state employees having choices of plans, increased deductibles and coinsurance and things like that. They knew it was coming. They wanted to be engaged to help educate and change the way their employees thought about things, or their members. And I think it's been pretty slow in the public sector relative to the private sector. So big change there. Okay, this is a big one. I'm not going to spend too much time on it, but I've mentioned a couple times the fee-for-service payment system and this change to paying for value and outcomes that the federal government and private industry. This is a big change for both insurance companies and certainly for hospitals and physicians. But this map here is a map of our what we call patient-centered medical homes and accountable care organizations where we're moving our payment methods to paying for value, outcomes, efficiency, quality, those types of things. So you can see, even though it's early on, first couple years of it, at least in terms of blueprint, pretty expansive. About 30% of our payments now go through these new payment methods. Long way to go, though. These are first-generation agreements, and of course the hospitals and providers have a big challenge to change their business processes and their mindsets because they grew up and were designed around the fee-for-service system. So this is going on all over the country, and you may have seen recently the federal government is stepping up their efforts in this area. So this is an interesting slide, something you may not know about us. We actually provide direct healthcare services around the state. So a couple things here. First, in 2 of our retail centers, we have 18 in the state, we have primary care services attached to it. The idea there is if we can integrate the services, programs, and information that we have as an insurance company with the primary care, we can deliver more cost-effective care. I mentioned the 2 staff model HMOs. You see them there, Florida Healthcare Plan and Capital Health Plan. We purchased a large multi-specialty physician group in the Largo area called Diagnostic Clinic. Again, the goal there is, can we help them move from fee-for-service to value-based? And then can that support a lower cost for all payers? Because that's an all-payer provider system, not just Florida Blue. We have opened our first GuideWell emergency medicine doctors right here in Orlando. The idea here, this is a freestanding facility, not the emergency room of the hospital, manned by certified emergency room doctors. So the idea is, if you have a more complex need, you can go there, more convenient, lower cost than the emergency room. And we'll open 2 more of those this year. And then our next one, which is very interesting to me anyway, is Clinic Sanitas, a GuideWell Sanitas Medical Center. So these are an integration of the health plans and clinics, medical clinics, in partnership with an organization called Organization Sanitas International, which is a company out of South America. It's an insurance company. They operate hospitals. They operate physician groups in countries like Colombia, Peru, and Brazil. So we're partnering with them to bring unique services to all of the people who have moved from those companies to Miami-Dade in the last few years. That's the trend down there. And provide a quality, cost-effective, culturally sensitive healthcare program. So those 3 centers will open later this year, and we'll see how they perform and go from there. But we're pretty excited about our partnership with that organization. That's quite new for us, let me tell you. I joined Blue Cross in 1986, so that's a long time, so you don't have to try to calculate that. We had two rules in our strategic plan for most of the time. 1, we'd never get into the delivery of care, and 2, we wouldn't get into Medicaid. We didn't know that market. We didn't have those skills. Those are the only 2 things we said we would never do. So I'll tell you, if you don't see more change now than ever, or more pressures now than ever, at least for us, they're there. Moving on to consumerism. Our industry is not like the retail industry, not like the banking industry. We don't have a great handle on consumers. You know, I was talking to one of the physicians that runs the diagnostic medical center, and he's an amazing guy. He gets up early, goes in, reads charts, gets things organized for the day, runs the shop all day, goes to school at night. And he sent me one of his long emails, midnight, and he said, "Hey, I'm learning about this thing called CRM. And I really don't know what it is, but I know I want it." Because he doesn't know that much about his patients. He knows their billing information, and he knows clinical information. And probably only the clinical information that goes on at the diagnostic clinic, not all the other clinical information. And he has no relationship with them. And think of it. You're now going to be paid for outcomes of your patients. And even your sick patients with chronic conditions, you see them maybe 3 times a year, 4 times a year for 5-10 minutes. No interaction in between. No follow-up, no support, no questions, no answers. That's pretty typical, especially when you remember most physicians in Florida are parts of small groups. Now, that's changing with some of the consolidation, particularly in primary care. But they don't have the time, energy, and money to understand consumers and run data analytics and engagement programs. But they know they have to, so that's going to be a major challenge. And even for us, you know, we have so much data, clinical data, operational data, purchase data. So what we're doing here in step 1 as we try to advance consumerism in healthcare is make sure we understand every single person in Florida, every single member. Run predictive models. We know when they have a gap in care that they're supposed to have. We can predict when they're going to get sick. We can help them go to low-cost settings real time. And engaging and connecting, navigating, steering, supporting. Healthcare is a very emotional time for people. I remember when my sister found out that her 12-year-old son had diabetes. No idea what it was, what that meant. What kind of doctor do I go to? Is it covered in my benefit plan? Is there another mom I can talk to? None of that. It's a terrible spot to be in. But in today's world with digital communities, for example. There's lots of companies that will hook you up digitally with experts, with social communities, with people just like you. So there's a lot going on in this engagement and connect space. And then the solutions. You got to have solutions that work clinically, but that consumers will participate in. Sometimes, our nurses will say, we're having a hard time getting our members to join our programs, and we got great programs. And then sometimes we get them in and they don't stay in. Well, you know what? Those programs are designed by doctors and nurses, and they're clinical only most of the time. And they don't have features and services and programs that are interesting and compelling at the consumer level. And so they don't stay in the program and they miss out. So this is a basic operating model that we have of understanding the consumer, reaching out, engaging, connecting, communicating with them in a way they can relate to, and then hooking them up to modern-day solutions at the right time. This is probably not a bad model for other organizations to follow. Our most visible solution is our retail centers. We were the first with these in the country. We now have 18 of them. Last year, over 325,000 people visited them. Turns out, in this high-tech age, when people have complex problems, and they're scared, and it's emotional, and they don't really know what's going on, a lot of them still really like to be able to sit down across the table from somebody that is well-trained and has empathy for their situation. So they're flooded, particularly when people have to purchase a health plan at open enrollment time. Our flagships, we have 11 of them. We can help you pick a plan that's right for you and your family, understand your plan. You'd be surprised how little members, even those who have been in the system a long time, don't understand the plan. I wouldn't say most. Lots of people don't really understand what a deductible is. So to be able to explain that to them, person to person, is important. We have nurses in these flagships that can do a health assessment and a personalized plan, and we use these as our community outposts. We have the state's leading healthcare foundation. We support organizations in all 67 counties, and we make these facilities available to them, and we have a lot of seminars and things like that there. Part of what we think makes us a great Blue Cross Blue Shield plan. We also have centers inline. We have store-in-a-store. We started with 2 in Walmarts, and as I mentioned, we have 2 with clinics. We're running a telemedicine pilot out of one of them in partnership with Miami Children's Hospital. So they're nice laboratories for us. Nice to have the interactions, a lot of learning, and gives us another way to support our customers. And there's our footprint. Our goal is to be accessible to the vast majority of our members. Okay, wrapping up here. Guidewell Center for Health Innovation, Lake Nona Town Center. If you haven't been there, to Medical City, it's right here in Orlando. It's quite the place. It's like almost like a Silicon Valley of healthcare right here in Florida. Leading providers, the VA, scientific labs, all kinds of companies coming together to do 3 things, I guess. 1, run their new operations here in that area. 2, help build and be part of a healthy community. And 3, collaborate. And that's why we're there. It gives us an opportunity to work with small companies, large companies, a lot of small, smart people in leading companies like Johnson & Johnson. So we're opening this year the Guidewell Center for Health Innovation later in the year, and that's what we'll do. We'll help incubate and accelerate startups. We'll convene groups for collaboration. We'll participate in studies of the community and technology. And we're really excited about opening up this center later in the year. Don't think you can really see that, but lots of great companies going there, lots of houses being built there, kind of a brilliant real estate development approach. So that's a pretty exciting area, and if you haven't seen it and you get a chance, I'd highly recommend it. Okay, last slide. I know that's a lot for early in the morning. So at a very early stage of transformation, I don't know where I came up with that all aboard thing, and it doesn't look like that fun of a ship to go on. And I don't know if you can see there, I didn't even notice this at first, but there's a shark, a big shark. It looks almost as big as the boat. So there's a lot of challenges in this transformation, but it looks like here anyway, we're past the shark. I do think we're past the tipping point. I think everybody gets it. Got to move on, got to change, got to provide more value. Hopefully these powerful industry stakeholders can continue to work together better, welcome in some of these new stakeholders, but not let them take too much. So it's a very interesting time, very important issue for all of you, I know. I really appreciate the opportunity to spend a little bit of time with you this morning. Hope you have a great summit, and thanks for the kind introduction, even though you mentioned the Buffalo Bills. And the lawyer, 2 strikes.